Hello, fellow scientists and committee members. My name is Daniel Cooper. Unfortunately, I have been snowed out in Ulaanbaatar, Mongolia, and am unable to make the presentation evening to present my findings on Prader-Willi syndrome. I will now have to present my findings to you via an audio-visual presentation that I hope will turn your minds into believing that the $5 million grant would be extremely beneficial to my research and could save millions of lives. Prader-Willi syndrome, or commonly known as PWS, is a rare and very complex, non-inherited genetic disorder. Several genes in chromosome 15 that come from the father have been deleted or are unexpressed. Some of the common characteristics of this disease include weak muscles, extreme and constant hunger, which leads to severe obesity, constant sleepiness, an intellectual disability, anxiety-driven behavioral outbursts, abnormal growth, and small hands and feet. PWS is caused by a defect in the hypothalamus, which is the region of the forebrain which coordinates both the nervous system and the activity of the pituitary. Controlling body temperature, thirst, hunger is also involved with sleep and emotional activity. This leads to a constant, uncontrollable hunger and drive to eat. This all occurs from the deletion of the unexpressed chromosome 15, which manipulates the DNA, creating the condition. If a mother with PWS developed the syndrome because of the deletion of a section of one of her two copies of chromosome 15, her child will have a 50% risk of being born with Angelman syndrome. That is, if the mother with PWS passes on her chromosome 15 with the deletion, the child will have Angelman syndrome. This is because the father's genes in that region that are linked to Angelman syndrome are normally inactivated. This means that the child will have no active copies of these genes, causing Angelman syndrome. If the mother passes on her normal copy of chromosome 15, the child will not be born with Angelman syndrome or PWS. In the case of a father with PWS who has a deletion in chromosome 15, there is a 50% chance that he will pass on the affected chromosome to his child, leading to PWS. This is because a mother's genes that are linked to PWS are normally inactivated, which means that the child will have no active copies of these genes. A diagnosis of Prader-Willi syndrome is usually made by a physician based on the clinical symptoms. PWS should be suspected in any infant born with significant hypotonia, which is when the baby will have weak muscles or floppiness and can be confirmed by a blood test. Growth hormone deficiency is presented in almost all children and many adults with PWS. In multiple studies, human growth hormone has proven to be beneficial for those with Prader-Willi syndrome. In June of 2000, the human growth hormone drug was officially approved by the Federal Drug Administration for those in patients with Prader-Willi syndrome. Human growth hormone is effective not only in increasing height, but also in decreasing body fat, increasing muscle mass, improving weight distribution, increasing stamina, and increasing bone mineral density. In addition, studies suggest it has positive effects on development and behavior. Many challenges do arise when considering the symptoms of PWS. The uncontrollable urge to eat is still yet untreatable and stops many PWS victims from living alone. The only way to treat someone who is suffering from PWS is to stop their appetite, is the strict environmental control of food near them and constant monitoring. Limitations of the treatment for this disease do arise and include the common side effects of the human growth hormone, which is nerve, muscle, or joint pain, swelling due to fluid in the body's tissues, numbness and tingling of the skin, and high cholesterol levels, and a high risk of diabetes. The human growth hormone drug is a common biotechnological treatment that is available for people with PWS and is highly efficient in helping people with this disorder. But this $5 million grant that I hope to achieve tonight is to fund my research into manipulating the human growth hormone drug that will help people increase muscle mass, fat loss, to have an effect that will shrink their stomachs of PWS victims by shrinking the digestive cells in the body and disable them to process food so quickly. The drug that I plan to invent will make PWS a lot easier to manage and allow them to live alone, as their uncontrollable hunger will be manageable, which will also eliminate the extreme obesity and over time will help younger children maybe have a chance of living a normal life and eliminate the chance of people being born with Angelman syndrome. Funding research into this condition would be the best option if you had a goal to save lives. My research could not just save PWS victims, but you can also get them to as close as normal people as you can get and can eliminate obesity, upgrading the health of every single one in the world.